So welcome on everybody. Welcome to RNPNTUTOR's USA. So we are trying a new thing today. We decided that we are going to explain nursing in a Patois. So I'm going to tell me how we do. I will choose some like a ticklish topic too. We're going to talk about congenital heart defects. Now in the US, congenital heart defects cost one whole heap of money. If you take care of one picnic, more than 100,000. In a 1 year, it costs over $1.4 billion. And then there are some 2014 statistics. Now, when we study congenital cardiac defect, the first thing you want to know is what congenital mean. Congenital, I like what Lady Gaga say. You're born with it, right? Baby were born that way. So you have different types of cardiac dysfunction, right? It can be a congenital cardiac defect or it can be an acquired cardiac defect. Now, if it's congenital, it means that the anatomical abnormality present when the kidney born, right? Now, the congenital defects them, we separate them in a acyanotic or cyanotic defects. If you look on the screen, it's a acyanotic. Acyanotic mean left to right shunt. What that mean? It mean the blood move from the left side of the heart and leak over upon the right side. Because normally, right heart blood pump go over the lung, left heart blood pump feed the whole body with good oxygen blood, right? So the congenital defects can either be acyanotic, like what the screen here show, or cyanotic, which would cause a right to left pushing of the blood from the right side of the heart to the left, or the congenital defect can be an even obstructive defect. Some of them we even call them mixed. But for right now, we're going to talk about acyanotic problems in these children. So when it is an acyanotic problem, like I said already, blood will leak from the left side, which is the side where I have one whole heap of oxygen over upon the right side. The blood from the right side, now where I go out the lungs, we kind of have too much blood. But we're going to talk about it. So the ones that are acyanotic are patent ductus arteriosus, for example, or coarctation of the aorta, or even septal defects. Now, any picnic will have an acyanotic problem. Them easy to get tired. You got hear a heart murmur. Them have increased risk to get inflammation of them heart or endocarditis. Them are gonna have some congestive heart failure symptoms. And them not gonna go good and quick and fast. Them are gonna have growth retardation because them sickly. Now, like I said, we classify congenital heart defects in a acyanotic or cyanotic. So now we're going to talk about the cyanotic one. Then you notice me write it in a blue. Cyanotic means the blood on the right side of the heart, which is the low oxygen side, a shunt to go over the left side and left side go out to the body. So the problem we start to have is you have reduced amounts of blood flow to the lung, right? Because some of the blood will leak go over the left side, right? When it want it goes straight directly through the pulmonary artery them to the lungs. So the first quick tip me I give you, anytime it's cyanotic, it starts with a T. You know, have to study that. That's something you have to learn about them something. Yeah. Anytime it's a cyanotic congenital defect. That means it's going to have a right to left shunting of the blood. It's going to start with the letter T. We are keep the thing real easy and simple. So what we mean by start with T? Things like Tetralogy of Fallot. That starts with T. That picnic they are going cyanotic. They might get bluish easy. They might always short of oxygen. They might have some problem. If I try tricuspid atresia, it starts with a T, right? It means them are cyanotic again. Real simple way I keep the thing. We not do no bag of something, right? If a transposition of the great arteries, even though you can consider that a little bit mixed too, but you got cyanosis. But that's why you get that, right? Two things you have to get. When it's cyanotic, a right to left shunting. Now you have to understand underline, you have to understand how the normal heart works. You have to understand that. All right. Now we're gonna first talk about tetralogy of Fallot. So I'm going to just give you a quick run through of how blood run at the heart normally, so that we can quickly talk about how it's running at the heart when there's a problem. So normally, if you're looking at this picture that I have, there's a right and left heart, right? Now, blood flows into the heart via the inferior and superior vena cava, and the blood, let's say the blood leaves the body, right? Or where we're using up blood. It's less oxygenated blood, and that blood coming in on the right side of the heart, from right atrium to right ventricle, and that blood goes through the pulmonary vessels, pulmonary arteries, away from the heart to the lungs. Now, where it got the lungs for? It got the lungs because it need oxygen. It go over the lungs, we have gas exchange, diffusion, osmosis, whatever they want to call it. We exchange, we pick up one whole heap of oxygen. When we pick up the one whole heap of oxygen, it will come back into the heart on the left side via the pulmonary veins, right? Veins vacuum things back to the heart. Arteries push them away. So it'll come back from the lungs into the heart on the left side. So left side of the heart is always the increased oxygen at the good up side. And that side they're going to send out good oxygenated blood down to your little toe, up to your forehead, to all your brain cells. That's how it's going to work. In the picture, them are born with congenital problems. Them born this way. So the first thing, look on the screen, you see Tetralogy of Fallot. Fallot is an eponym for the man of them name after it or whoever, when I respond. But Tetra means 4. So 4 problem I got in at a one pick near art. If you're born in Jamaica, you can study this by saying Ross, like a curse word. Because you have a right ventricular hypertrophy, you have aortic displacement, you have a septal defect, RAS, and last S, stenosis of the pulmonic valve. So if you use RAS, it will remind you of the 4 things wrong with the heart. Anyway, on my screen, it is prepared for several different cultures. So we don't have it in a Patois. So we have VSD, which is the ventricular septal defect, right? That is number 4, if you look at the picture, right? A septum is a dividing wall. And when you have a hole in the wall, we call it a septal defect. If it is at the lower part of the heart, don't listen in the ventricles, we say it's a ventricular septal defect. Real simple, it just means that you have an opening between the left side and the right side of the heart, down at the ventricles. Done with ventricular septal defect, right? Make we learn about this though. 4 things wrong with a picnic heart. It starts with T, that mean them cyanotic. I'm gonna make sure I put the cyanotic baby so you see him like a blue tinge them all over him. So you know say anytime him do any activity, him short of oxygen. Just understand it that way there. 4 things wrong with the heart. Number 1, we have narrowing of the pulmonary valve, otherwise called pulmonic valve stenosis. Stenosis means narrow. If something very narrow, you can't get nothing through it, so good. Right? So we have a narrowing of the pulmonary valve. That means when blood left the right side of the heart for go over to the lungs, it have to force and build up one heap of pressure for go up through it. So through it have to build up so much pressure now. The right ventricle, where it have push the blood, it starts swell. Just like if you do 100 reps right now, with a barbell and just a lift, your muscle are going to get hypertrophied. It are going to get big. I just say in the heart, when the right ventricle get big, it not good. It come like a big dead, right? So on the right side, right, the muscle hypertrophy. So then it can't push as good. It start build up pressure. Problem with the pressure building up now is that it's gonna make it hard to get blood over to the lungs. Hence why we say them are gonna have decreased pulmonary blood flow, right? Because the pulmonic valve narrow, so it increase pressure down in the right ventricle, and so that a force, you have to push the unoxygenated blood through the ventricular septal defect. Now, the problem with the ventricular septal defect is that the blood not only a leak from the right side to the left side of the heart, the blood a leak go up in the aorta because them have an overriding aorta, right? That are the A in the RAS. R after the right ventricle get big, the A after the aorta displaced. What that mean? the aorta find itself right over the septal defect. So when the blood leak through the septal defect, it do nothing more than go over on the left side of the heart and some might gone up in the aorta. Is that a good thing? No. Because you have low oxygenated blood gone out to the body. So low oxygen blood gone down on my little toe, gone up on my brain. It's going to be a problem, right? So make you understand the thing again. It have 4 problems of the heart. Right ventricle, thicken or hypertrophy. The aorta rather is displaced. And then we have stenosing of the pulmonic valve, stenosing or narrowing, you want to call it. And we have a septal defect down at the ventricles. 4 abnormalities, and this a one pick near heart. No wonder them have hypercyanotic spell. Them must get blue. Them not get no oxygen. Let go and learn, yeah. So, in your questions, it has say something like, for example, the nurse is taking care of a child and the child start to have some breathing difficulty or crying while the nurse was feeding the child a blow shot or use accessory muscles. Them something there is a TET spell or a blue spell or a hypercyanotic spell. If it's a little baby like an infant, like what up on the screen, you put the baby in a knee chest position. So put that feed the baby there, them start crying dead by and get blue. You push up the knee in the chest, knee chest position. You see the next picture in the picture, you notice him a squat that I become a little older, maybe him a 2. So for him body through evolution and make him brain, make him squat. When him squat, it make more blood flow to the lungs, long story short, right? And the squatting kind of calm the child and kind of make them breathe better. But of course, we have one whole heap of management and treatment for things like Tetralogy of Fallot, right? So we have a talk about it. You have to remember to never remember to tell me, say, in a tetralogy, the tricuspid valve, tri is always right. The tricuspid valve fails to develop properly, right? So there's no good communication between the right atrium and the right ventricle, and that's why the blood has to flow through some septal defects for go where it needs to go, basically. But all right, so how would we take care of this picnic with Tetralogy of Fallot? Now, there's a whole heap of interventions, medications, surgery where them can do. We're going to talk about this from a general standpoint and go a little detailed. So, you can surgically manage Tetralogy of Fallot. Them can connect the subclavian artery to the pulmonary artery, but that would be palliative. That not fix it for life. That does make the picnic get more blood flow and breathe a little better, right? Them call that the Blalock-Taussig procedure. Usually when things name certain name after the doctor, them first do it. And them forget them props are big things, right? So it's a palliative surgical procedure, meaning it not cure you, right? It comforting, right? Make you breathe better, live better, right? It increased the pulmonary blood flow, can connect the subclavian artery to the pulmonary artery. Now, when them really want to fully repair them picnia, the curative repair is repair of the pulmonic valve. Remember, when they have narrowing or stenosis of the pulmonic valve, them are going to widen that. Then the septal defect, we did have a hole in the heart, them are going to put a patch over that. Look on the screen, it's a VSD repaired with a patch, yes. Them lock it, them close it. And then the overriding or displaced aorta, them can repair that to fix it more in a feed position. Otherwise, them have to get drugs like Lasix and the Jackson. So what them I get Lasix for? Them I get Lasix because them heart a fail. So whenever your heart a fail, fluid a build up in your body, right? So more time, all you think about this, you say, this is just like a heart failure now. When the right heart fail, you know a peripheral edema, peripheral around the edge. So on our foot and eye as well and them something. When at the left side of the heart the problem and now work good, you get pulmonary edema. What pulmonary mean? Your asthma doctor them name pulmonologists and them people. I could have allergists to say, but we're gonna say pulmonologists. I want it to work for the lecture, right? So pulmonary edema mean you have edema in a lung part, in a lung system. That is never good. See? So we need drugs like furosemide, you see me? to get out the fluid. To diurese, I forget fluid out of the body via voiding or peeing. So you get a drug that is classified as a diuretic. Furosemide is a loop diuretic. Good thing, man. Get a member, right? And if your patient on, I would say, any diuretic like this, whether it's a thiazide diuretic like HCTZ or diuryl, or whether it's furosemide, what diuryl read the name, chlorothiazide. Any one of those two, your patient is at risk for hypokalemia. Meaning, when them a pee out everything, them a pee out the potassium too, and I lose the chloride too. So we have to put them on strict intake and on. We have to do it, right? We have to put them on strict intake and out because we have to see if them again weight. Anybody will gain more than 3 pounds in a 1 day, or I don't remember how much pound in a couple of days. But me use a 3 pound in a 1 day, it's a problem. So daily weights, intake and output. Now, we telling us say them pick me a tired easy and an activity make them get cyanotic. So that means to say you can't do everything one time. You have to give them like a feeding and tap. Frequent respire, they come back, come probably change them, they tap. They come back, come beard them, they tap. You can't do everything one time or the picnic or tired, get cyanotic, going on a test spell and start dead fire. That's all you have to think about it, right? Now, furosemide real quick, it causes hypokalemia, nausea and vomiting, and I left out something. I don't know. Hypokalemia. Chlorothiazide, a similar thing. Yeah, about the same thing, right? Now, except that it works like a different. Instead of excrete the chloride and the potassium, it decreases the reabsorption. So one and the same. All right. Digoxin now is a drug where you need to pay attention because digoxin is a cardiotonic. It's slow and strengthen the heart, but it will tap it. If you're not careful, it will tap the heart. So you need to know your dig levels. Me, I go say 0.8 to 2, but me all. So maybe your book I say something else, looking at your book. 0.8 to 2 are what me I use. Now, anybody where I get the digoxin, you have to check them apical pulse first. Assess the apical pulse 1 full minute. Don't tap a 15 and multiply by 4, because you will count wrong. And the digoxin will kill them, and you're going to go to prison. So, assess the apical pulse, especially in your infant, right? I think them say all the digoxin if them infant are less than 100 beats per minute. But then have to quote me, look by your doctor's orders or your question I said. The other things about the digoxin, again, you have to monitor intake and output because anytime you lose too much of your electrolytes, like you get like say your potassium get low, or your calcium get high, or your magnesium get low. Kind of calcium and magnesium inverse. Any one of them something there, increase dig toxicity. Or you know, so the baby are gonna get toxic. Well, you can check dig levels, in your labs, diagnostics, whatever. Or you can look pan the pitney. If them a vomit, a good little digoxin. If them heart rate I go slow, bradycardia, a good little digoxin. Remember say digoxin add more while it's in a micrograms and not milligrams. Pay attention if you give to the people them baby and a little syringe and you have to drop one little bit. Make sure a one little bit because you will kill them. Anyway, I think I cover most of the important points as far as which one this tetralogy. I might stop yourself for today, you know, because I have to listen to this and see if it's sound or it for sound. But basically, before I'm done, any child with a cardiac problem we are care for, you monitor vital signs, you look for how them breathe. Because you know, say by right, when picnic have breathing issues, you see the nose are flare out and a stretch out. You look if them are breathe with them accessory muscles. Or you know about accessory muscles, look at them side, if them belly are sinking and them something there. Take out your stethoscope, if you're posing in your car, and take it and listen to them breath sounds. Or you gonna know crackles, it kind of sound like them are snoring at them chest, kind of. It sound wet. I'm not gonna lie. It gonna sound like when you blow your nose-ish. But in the chest, I can't explain it, but yeah. Now, if you notice that them respiratory effort give problem, them a try hard to breathe. Then your question them gonna have things like place the child in Trendelenburg, place the child in reverse Trendelenburg. this is how you have to think about. When people can't breathe good, it no matter who, infantile 96-year-old, bring up them body, bring up them head. So if I'm me, a big old girl like me, you make me sit down up. I foulers. If a baby, they might tell us something about reverse Trendelenburg. It simply means elevate the picnic upper body, not make the head go low. Right? Because if you bring up the head, the work of breathing is less. It's easier to breathe. You will give them humidified oxygen. Why is that humidified? What that mean? You create water. So depending where you work, it have to be condensed oxygen then. I don't know if I explain to you, but one, the oxygen not dry them out. Right? Usually them I get one whole heap of oxygen, like 100% by face mask or something like that. They might need ET tube, they might need vent, right? Them are gonna need morphine, them are gonna need IV fluids. And then you monitor the picnic for heart failure most time in a cardiac defect. Oh, you know if a heart failure, you know watch your fluid retention, you know them things there, right? Because if your heart a fail, that means blood not pump where it for go. And if it not pump where it for go, it go back up somewhere, right? You go check peripheral pulses. Kind of that pulse tell you if the heart a beat. So you check them around the body. You monitor the intake and output. You weigh the infant diaper them. Right? If it's a big picnic, you weigh them daily. If them put them on fluid restriction, you maintain that. And you give them any medication as necessary. And you teach the parents about the TET spell and them something. So we just talk about cardiac defects. I hope everybody learns something. Skip one more. Alright, we now cover septal defect. So, sorry, can't go back. Well, the person with tetralogy have a septal defect, but we're going to end this lesson right here. So, I want to let me know in the comments if it help, you know, if my chat too bad, if I should cuss some more about it, if I should make it better. If you like it, let me know. If you want to go back to welcome to RNPNTUTOR USA, I'll do that too. But I'm going to try something for me. Caribbean nurse them, because I know the struggle is real in a nursing school. Me know that. So thank y'all, goodies and gentlemen. Big up on yourself. I'll see you in the next video.